Essential tremor. I don't have any financial disclosures. Products mentioned are only for the references. We all do microsurgery, especially as a glaucoma surgeon. We need to have a good, steady surgical hands so that our outcomes are better. So, the essential tremor is a neurological condition that causes involuntary and rhythmic shaking. It can affect the hands, though it may also affect the head, voice, arms, or legs. It is very common, like more than 1 million cases per year are seen in India. There are various types of tremors, like we have a resting tremor, which is common to see in Parkinson's disease. We have a postural tremor, that is what we are discussing today, is the essential tremor, and other physiological tremor also comes under this. Then there is something called as a intention tremor. There are various risk factors involved in the essential tremor. Those who are above the age of 40 may be affected. The genetic mutation is the commonest cause in this. Either one of the parent with the genetic mutation gene is seen. If they are exposed to neurotoxins, that is prolonged exposure. Also prolonged exposure to the chemical toxins like lead, iron, manganese. And also when they are exposed to the pesticides, they may be under risk of developing this. The essential tremors can be aggravated by fatigue, anxiety, sleeplessness. There are very common symptoms. The patients may have a very fine tremors. For us, it is usually the tremors during the surgical procedures, especially like trabeculectomy or very fine surgical procedures. The tremors can be symmetrical or it can be asymmetrical. In general, it may be more of symmetrical in nature. It can become worse when the caffeine is taken. When there is a very little alcohol is taken, for some people, the tremor may disappear. This is the typical of essential tremor. The condition can be treated with drugs. It can be the exercises can help the patients, and also there are some assistive aids can also help these patients. If the medications are not controlling the disease, one may look for the surgical options as well. The commonly used medications are the beta blockers for this condition. Also, there are other medications like tranquilizers, anticonvulsants like primidone, also gabapentin, and also the topiramate. All these drugs can be used in conjunction with the propanolol, or the propanolol in isolation can be used depending upon the condition. Usually, the propanolol is the commonest drug used for the essential tremors. The usual dose is to start with the 10 milligram once a day or twice a day, and it can be increased up to 360 milligram per day in divided doses. But the commonest problem is the bradycardia, bronchospasm, hypotension, fatigue, lightheadedness, dry mouth, and of course the dry eyes. It has problems also like contraindicated in asthmatics and COPD patients. The other drugs which are used in the essential tremors may be primidone and the topiramate. The assistive aids for the essential tremors could be the steel weighted and also the gripped utensils, and also you can use wrist or angle weights which can help the patients to reduce the essential tremors. There are various type of exercises given for the hand tremors. There are different websites that you can go and see that what are the good exercises which can help these essential tremor patients. If the medications are not helpful and assistive devices are not very helpful, one can look at going in for the deep brain stimulation, which is commonly probably done in cases of Parkinsonism. The success rate for the deep brain stimulation in essential tremors is close to 90%. Also, there are other surgical procedures like focused ultrasound for tremor and also the thalamotomy. These are the other surgical procedures which can help the essential tremor patients. Hope these tips are useful for you. Thank you so much.